Open up a case, which is a DXD file. It will just have numbers on it, and you open it up, it comes to this, and up here will be different stuff. It will not be what it should be. It should have the dentist name here, and it should have the patient's name, last name, first name, the order number, whatever the case is, and your initials. If we do not update this correctly, it's going to have a bunch of stuff here that is not correct. We do not have this many doctors in this place. A lot of this here are patients' names, or a doctor that was spelled 3 different ways.
Oops.
See right here, 3 different ways here, and I guarantee it's going to say a Dr. Wright up here. Dr. Wright and Dr. Scott Wright. So we have 5 Dr. Wrights. And every time that we have to look for his stuff, we have to look in 5 different sections. So that's why it's always important to put the same thing down every time. So look for Dereese. Here it is. There's 1 Dereese. All right, implant. Open it. Now that you've had your positioning and you're to the design part of it, a lot of stuff is going to be very basic, but I want you to mess around with it to see what happens in different places and see what becomes of different choices. So you can turn on and off your gingiva right here in the menu, and you can also change the transparency of it. That will help when forming what you need to. A lot of it you'll be using shape, which is a push and pull tool, and use it accordingly to match the dentition that is already there naturally. The margin will be very small compared to a natural tooth, but do not use that as a crutch for bad contouring, because you can always contour from nothing to make it look more full, such as that. So get your contours correct. Pushing and pulling with the shape. Adding, subtracting, smoothing with form. If you get to where that it just doesn't look right, you can always recalculate by clicking on recalculate and apply. And it will start over again from step 1, the initial presentation, like that. And then you can start back. There is no version that works in a certain order. So this is where you can find what works for you and embellish on that. What works for me in a certain order may not work for you, but as for me, I try to get things smooth, so when I start moving things, everything is in a good shape to begin with. And the basic shapes are very important when it comes to comfort, especially when you have a lot of teeth that are in a certain alignment, and the patient is used to having a certain alignment of their teeth. You want to mimic what the patient has already. So if the teeth look ugly, make this look ugly. And it will look correct in their mouth. Once you get your basic anatomy of what you want, then you can start looking at the contours of the occlusion to match the adjacent teeth. Usually the computer is able to do that automatically. So what I'm saying is, if the patient has sharp anatomy, it will place sharp anatomy here already. And tools that you can use easily is adjust contacts, which you can choose distal, occlusal, or mesial, and it will take away the high spots automatically, just like that. For implants, you want no contact, no greens like these areas here. You want it out of contact, and once we are done with it, if we use a model to make it, we want 6 shim stalks of drag. So where it is completely not touching. Having constant pressure on this tooth will damage the implant that is in the bone. A lot of impact over and over and over will weaken that and degrade the bond that it has made with the bone structure and the implant itself. The bone has incorporated itself into all the little fine areas, and some implants have holes in it where the bone grows into it. So to make it stronger, a better anchor, and when it's constantly under pounding pressure from chewing, grinding, biting, it takes away the integrity of that bond, and then it fails completely. We do not want to have large openings like this big triangle here. It's a major food trap, so we need to bring it out and close it more ideal. That being said, I'm not expecting you to have it all the way touching here, because that creates an undercut. It should not be straight up and down, but it should have a smaller triangle there, and more like that.
It looks like a tulip.
Yeah, I guess it does, huh? And just depending on the size of the tooth, you have different shapes of it. But it is coming from a perfectly round platform to a tooth-shaped crown. So by moving things, you'll move other areas too, and take that into consideration, and you can easily check it out by taking away your cast and seeing what is being affected in different areas. And you want these areas here to be in a green contact, a nice broad area. And on mine, I did not take away that dimple that you guys had, so I have a hole there like a donut. Even though it's flat, there's a negative area of contact there. So you want a nice broad area of green. The broader it is, the better for the doctor to make adjustments in the mouth and keep a contact. So on a computer, you want nothing more than a light blue contact area like this. No more than that. And here you can see how much pressure It's giving on the gingiva. If it's coming through a lot, that's a sign that the doctor will have to cut the gums away to establish that fit. Sometimes it's good, sometimes it's bad. When that happens, you have to show the doctor so they know what to expect and to give the okay whether to allow it to come out into the gingiva, knowing that they're going to have to cut that away to make it fit, or ask you to make adjustments to make it less invasive on the gums. Depending on the depth of the implant, it might be a lot lower and a lot more gums are affected, and that's where you have to show the doctor the difference. Any questions so far?
No question.
All right. So just by having a small platform to start from, everything about it is going to look weird already. So from the occlusal point of view, you want to see that the sizes are about the same, your cuss tips are in alignment, the shapes are matching.
Oh, I have one question.
Yes.
What was it that what sequence of buttons did you do to get the green to the blue?
This?
Yeah, didn't you click
Yes, I went
Yes.
to adjust contacts,
Adjust contacts?
and there you can choose distal, occlusal, or mesial. So I will show an example. Say I'm going to add here to make it a hard contact, and add here. Okay? I can go to adjust contacts, click occlusal, it will take it down.
Okay.
It doesn't know exactly what I want,
But it gives you rough.
but it gets the job done on the high contacts. Same thing with the distal. I click distal, it takes it down. And then I can make adjustments from there to make it correct. So it does a lot of the work for me, like that.
Yes.
Does that make sense for you? And it works for only 3 sides. That's it. And it doesn't just affect one contact. If there was 7 contacts here, and if they were high, anything more than green, it would take it all down at the same time. It will take down the surrounding area minimally, but it would take down the affected area the most.
Gotcha.
All right, so once you get what you want, now there needs to be a way to get the screw into it. So we have to add in a screw channel. To add in a screw channel, there is a tool right here, screw channel. And to get that, we need to see the actual scan of the model. So I'm going to show you what I'm talking about. That area right there is still kind of hard to see because of the minimal thickness that is showing. Turn off minimal thickness and you'll see it. That is what the screw channel needs to line up with. Straight into there. Just like that. Not angled, but straight in. So I add screw channel, and I'm choosing 3 millimeters. 3. Enter. Add screw channel. And it shows an option. Right away, I can see that it is not correct. I can move it different ways. Up here is to tilt it around. Then I have the arrows to move it sideways, two-dimensional, or I can grab the middle and it moves it all at the same time. The tilting works independent of everything else. But I can move this on the square like that. Okay? So I need to look down upon this straight onto that, move that circle just about where I need to at the base of it, and then move this to where the yellow is one piece. Right there, I can see the yellow is not connected. That is straight in line with it. And to assure, I can move it like that and see it. And I can turn it to see how it is. And I want that in alignment with that. Once that is good, I can click screw channel again, add my restoration, and there it is. Now I have a hole there for the screw. This would be a screw retained crown. Finishing it up with the export, milling it into wax, that is ready to be casted. From here we can do anything else just by stepping back one step and doing something else to it. This right here is a full contour, full wax up, and from here you would save it, and we would be able to make that out of wax or make a reduction for an abutment, which I'm going to show you next. So I want you guys to get it up to this, and I'm going to show you what's the next part going to be. It's going to be making an abutment just for this. We're going to click reduce in 1.5, and we are going to make our own margin right at the gum line, like this. Now this only works if you can see through the gingiva. So take away the cast so I can see better, because it would not work if the gingiva is blocking everything out. I cannot get this to where I cannot see. See, I'm moving this, it's not moving. The gingiva has got to be transparent, at least by 1%. So now I can move it. So you're going to double click and single click around right at the gum line. Higher on the lingual side, because it is more difficult for the doctor to get to the lingual side to clean the cement. This is going to be a custom abutment to fit this mouth only. Go all the way around, double click to end, and now I'm going to press apply, and I have a custom abutment for a crown to fit on. Even though it is not completely correct, this is how it will be started, and from here it can be reshaped to make a taper. Slightly by here, and the other part will be by hand with instruments, handpiece. Something similar to that. And a crown would be made afterwards by rescanning that in gold to make a crown just for that. Can you picture it? That being gold on that abutment. So get it to full contour with good contacts, and then we'll proceed on. Okay?
Yes.
Any questions?
Not yet.
We do the apartment, the prep apartment?
No, just full contour.